It's a small world, and I'm here every Tuesday answering your dental questions. If you have a question, comment below and I'll make a video about it. I'm Dr. L, and this is Bike Bite. A viewer recently asked, what do you think about do-it-yourself at-home whitening products that you buy in the store? Is that any different than what you sell professionally? What do you think? So, this particular viewer did have a great question. And it is essentially the same material, but it's a different concentration. So you get the same results vastly quicker if you go see a dentist, get professional grade bleaching trays. I'm going to tell you more at the desk. See you in a minute. I should have known it would be you. You're always waiting in my office for me to follow up with the next part of what we were talking about. So like I said, a recent episode of Bike Bite, a viewer asked the question, what do you think about DIY tooth whitening? Is the stuff they sell at the stores different from the stuff you sell professionally, or is it the same? What's the difference? And it is essentially the same stuff, but of different concentration. You see the stuff that they sell at the store, without them professionally instructing you person to person how to use it, they are only allowed to give you a low percentage that you can't really hurt yourself with. Whereas because I can talk to you face to face, or your local dentist can talk to you face to face and train you on how to use the strong, high concentration material, you can get the results you're looking for a whole heck of a lot faster. But if you're willing to actually spend more because you're buying more material and wait longer to get the results that you're looking for, the store-bought stuff is okay. So let me talk to you about 3 different types of whitening products. First off, there are whitening strips, like this. You buy them in a big box, they're not custom to you, you take the strip out, you put it on your teeth, and you press it down, and then as you are keeping it in your mouth, you'll continually have to press down where it lifts off. It's not the best, it's the cheapest, and it will whiten your teeth. There are low concentration sold at the store. I sell a more expensive, high concentration version. But if you ask me what's best, I would go for custom bleach trays. Let me show you a picture of that. So this is a custom bleach tray. We take impressions of your top teeth, your bottom teeth. We have a model of exactly what your teeth look like. We do what's called a suck down. We use a machine to take a clear plastic film. It sucks down, heats it, and makes a nice tray that adapts to your personal teeth perfectly. And then you put a little droplet of bleach in the trays. Now, over your lifetime, you may want to touch up the whitening. You only buy the custom trays once. That's the expensive bit because it requires time to make them. But the little syringes, they're rather inexpensive. If you want to spend the least amount of money over your lifetime and you're going to bleach every now and then, like once a year is good expectation, if you go to your local dentist, like me, buy custom bleach trays, and then also buy a syringe every couple of years, once a year if you want the freshest of bleach each time you use it, you'll spend the least amount of money. Now there's a third option. Some people say, no, Doc, I know I'm not going to do the routine every night, and I want the results today. I have a wedding tomorrow. We have a step up. Now, I do charge more, but I still want people to be able to touch up their smile once a year if they choose to. So I throw in the custom trays at this elevated level. But what we do is we put this green composite around the gums to protect the gums because the bleaching agent is actually so strong that if we just paint it on the teeth and allow it to gently go to the gums, if we don't protect the gums by physical barrier, then the bleach will whiten the gums, and it'll be a white spot for about a few hours to a day. It doesn't look that good, and if you haven't done it before and you don't know, oh, okay, it'll be okay. If you're patient and you've never had that happen, why is my gum white here? This is scary. So we paint composite on there to protect your gums so you don't have that issue. But then we use a light, and there's a lot of marketing with light. Don't buy the hype, okay? I use a laser in the office for other procedures. I also use the laser at a specific setting. All it does is activate the gel so that it works faster. It doesn't make it work better. It just means that instead of putting the gel on your teeth and waiting, giving it time, all of the activity of the gel is released by the light, and you can rinse it off very quickly because it's already done its job. So when I paint on the very strong bleaching agent, and then I blast it with the laser, then I'm able to clean it off, and the patient is in the chair a very short amount of time. There's one thing I want you to know about bleaching. If you have sensitive teeth, bleaching will increase the sensitivity. If you're susceptible to sensitivity, then you may notice that if you bleach your teeth that you have some discomfort there. So if you are susceptible to sensitivity, what you might want to do is bleach one day and use a desensitizing agent the next day and alternate. Personally, I like potassium nitrate. A lot of people like fluoride products. Use whatever works best for you. But the thing you've got to know is the higher concentration bleach, like is sold in a dental office, if you've got sensitive teeth, you'll notice it more because it's stronger. And if you opt to have that in-office one-day whitening, that's the strongest stuff. If you've got sensitive teeth, you may be really uncomfortable and have to use desensitizing products for a few days. So if you ask me what is best, Doc, I think the custom trays are the absolute best. If you have sensitive teeth, you have to have a conversation with your dentist about it. What might be best for you is to use some desensitizing products. In my patients that have very sensitive teeth, what they do is they do 1 day of bleaching, 2 days of desensitizing product, and then the cycle starts again. So it takes them 3 times as long to get to that same bleach level that someone who has no sensitivity is able to do, who uses it all 3 of those nights, where the person with sensitive teeth is only using it on the first day and the other 2 desensitizing solution. I hope that answers your question. If you'd like to see us in a professional manner, here's our information. Everybody, have a great day.